we shall now discuss about one of the new standards which has been introduced by the 6th edition, or rather introduced in the 6th edition by the NABH, and this is regarding AAC 11. This is the standard AAC 11, and that involves preventive and promotive healthcare. So we shall discuss how the organization can implement the requirements for this standard. So first of all, the organization should make a written guidance regarding these things, and this can be considered under the next 4 objective elements, and this will include preventive and promotive healthcare, secondly immunizations, and third prevention of non-communicable disease, and fourthly about how we are going to implement these things. Now coming to preventive and promotive healthcare. Now prevention can be considered, or the guidance can be written under the following headlines. That would be number 1, the immunization, number 2, lifestyle modifications, which again go into prevention, and thirdly about the promotive healthcare, which again includes lifestyle modification. Now the other 2 objective elements are regarding the immunizations. Now immunizations can be considered under the following headlines. It could be, the following headings, which could include the immunizations for children, that is childhood immunizations, then the catch-up immunizations for children, and thirdly the adult immunization. Now the childhood immunization should at a minimum be according or as per the universal immunization program, but in cases where it is possible to give additional immunization, that could be done as per the various other guidelines like the Indian Academy of Pediatric guidelines and so on. So this is about childhood immunization. Then the catch-up immunization again is basically for children and adolescents, and this is where you talk about immunization of children who have missed certain doses in the past. Then thirdly, we include the adults. Now for adults, there are immunizations regarding specific illnesses, and this would be again age related. In those elderly people who are over the age of 65, we consider giving immunization against pneumococcal diseases, against herpes zoster and various other things. So this is about adult immunization. Then coming to the prevention of non-communicable diseases, this again could be age related. Like in children, we could talk about prevention of autism, prevention of deafness and hearing, speech, and also visual disturbances. All these things could be prevented if detected early, and also prevention of obesity, prevention of hypertension and diabetes and so on, and this is for the children. Then in adults, we could talk about prevention of obesity, prevention of hypertension and diabetes, and also early detection of illnesses like cancers, colorectal cancers, breast cancer. So these are the things which could be done. Now how do we actually implement this? This implementation could be in the form of patients who come to the hospital, and we could implement all these things which have been written down. We could also conduct camps like school health camps, where you can implement all these things which I just mentioned. You could also have special education programs in the hospital, where we can celebrate various World Health Days like World Hypertension Day, World Osteoporosis Day. So during these days, we could have specific education programs for the patients who come to the hospital. We could also do things like school health programs and various other things. So these are some of the things which you could do to implement the requirements of this particular new standard. Thank you.